Traditional electronic health records rely entirely on centralized databases. This structure forces gigabytes of sensitive medical history into a single point of failure. Within these systems, top-level administrative accounts maintain root-level access permissions across the entire directory structure. If an attacker compromises just one of these accounts, they bypass all local security protocols, turning the database into a honeypot for extraction or undetected modification. Blockchain networks solve this by decentralizing the trust model. Instead of relying on a centralized server and an administrator, data ownership is secured through distributed consensus and cryptographic keys held directly by the user. However, applying this directly to healthcare presents an engineering paradox. Blockchains are engineered to handle tiny packets of transaction data. Attempting to upload a multi-databyte medical file, like a high-resolution MRI scan, directly to a blockchain mainnet would immediately trigger block size limits and incur tens of thousands of dollars in network gas fees. Furthermore, a blockchain is a public, transparent ledger. Storing raw, unencrypted health data on a network where every transaction is visible to every node is a direct violation of HIPAA compliance. To achieve true patient data sovereignty, the system architecture must strictly separate the storage of the raw files from the cryptographic logic that controls access to them. The MediVault protocol addresses this by implementing a structured hybrid architecture designed specifically to solve the decoupling problem. This diagram outlines the macro blueprint of the MediVault system. It establishes a highly structured stack where data storage and logic are intentionally siloed. The stack is divided into 4 main functional layers. Client interfaces provide access for patients and doctors. An API gateway handles middleware requests. A blockchain core executes the immutable state logic. An off-chain database and AI layer manages the heavy file storage and analytics. By executing logic on the blockchain while keeping the heavy payloads entirely off-chain, this structural separation prevents network bloat while maintaining a mathematically verifiable chain of custody for every piece of health data. The first requirement of the system is securing heavy, sensitive medical data locally, ensuring it never causes mainnet congestion. Before a medical record ever touches a network, the system applies local symmetric encryption, using AES and RSA standards to the raw health record. The plain text file is converted into secure ciphertext on the client side. Once encrypted, the ciphertext is deployed to a decentralized web of nodes known as the InterPlanetary File System, or IPFS. Looking at the top section of this flow, as the encrypted file enters an IPFS node, the network processes the payload and returns a hash, creating a unique content identifier, or CID. This CID is a lightweight cryptographic string. It acts as a pointer, representing the data's location on the decentralized network and proving its structural integrity, all without containing the heavy data itself. The IPFS network then splits the encrypted file into multiple shares and distributes them across various geographic nodes, preventing any single point of failure. This terminal log shows the real-world instantiation of this decentralized network. A live IPFS daemon initializes, establishing swarm listening ports to seamlessly sync with the node network. Because the file was encrypted and fragmented, an attacker compromising a single IPFS node would retrieve nothing but unreadable, fractured ciphertext. By combining pre-network encryption with IPFS distribution, the system mathematically reduces massive files into secure, blockchain-compatible strings. Now that the file is safely stored off-chain, the system must establish strict rules over who controls the decryption keys and the CID pointers. MediVault delegates this to permissioned Ethereum smart contracts, written in Solidity. These scripts serve as the programmatically enforced access layer. A patient's digital identity wallet generates a cryptographic signature. This signature binds directly to the CID metadata block, creating an indisputable link between the human user and their off-chain data. This shifts access control away from vulnerable, centralized server administrators. Instead, permissions are enforced entirely by trustless state execution on the decentralized ledger. The smart contract is programmed with explicit parameters. It allows the patient to grant a doctor specific access, revoke those rights instantly, or enforce strict, time-limited permissions that expire automatically. Every time a permission state changes, the blockchain generates an immutable audit log. Every single access request is tracked permanently, providing complete transparency. This Ganache testnet console displays the back-end verification of this ledger architecture, including the allocated private keys, base HD paths, and active RPC listening ports. Engineering teams utilize local EVM testnets like this to rigorously validate the exact parameters of the contract logic, ensuring gas transaction costs are optimized. By removing human administrators from the loop, smart contracts give the patient irrefutable cryptographic control over the state of their data. To give this secure data clinical utility, the protocol must safely route on-chain logic to external applications, like hospital dashboards or medical machine learning modules. MediVault handles this via a server and API gateway layer engineered with Flask and Node.js. This middleware securely handles requests between the client and the blockchain. Returning to the architecture diagram, the middle block represents this API gateway, routing validated requests directly into the right-hand database and AI modules. When retrieved, the middleware formats data to comply with FHIR standards, normalizing it for cross-platform compatibility. Once normalized, the data is securely routed from the gateway directly into the AI analytics module. The machine learning service operates in an isolated sandbox. It fetches normalized patient datasets and executes decryption locally within this secure environment, ensuring the raw data is never exposed during transport. Inside the sandbox, ML classification models process the structured data. The algorithm cross-references input parameters to detect abnormal health patterns and generates predictive disease risk scores. This terminal log captures the live backend successfully synchronizing these disparate technologies. The node server maintains concurrent connections to the isolated ML service, the blockchain node, and the MongoDB database. To ensure the blockchain remains performant, MongoDB is utilized exclusively to manage heavy off-chain application metadata, keeping heavy queries off the distributed ledger. By leveraging standardized FHIR payloads through secure API middleware, the architecture successfully feeds complex machine learning models without ever exposing raw patient data to a third-party aggregator. This is the React front-end UI. It is the only layer the patient interacts with, abstracting the deep cryptographic protocol into a clean interface. When a doctor clicks to request access on the UI, it triggers JWT authentication at the gateway. The gateway then passes the request down to the smart contract for a rigorous permission check. The smart contract validates the state and releases the exact CID. This prompts IPFS to locate the file and return the encrypted payload to the client side for local decryption. That decrypted FHIR-formatted data routes into the ML sandbox, processes the patient's risk factors, and returns a verified predicted risk score straight back to the clinical dashboard. The end user experiences a seamless application, but beneath the interface, the data relies on mathematically verifiable integrity, flowing through an entirely trustless stack. Because every transaction leaves an immutable on-chain audit trail, this architecture natively addresses the compliance and interoperability blockades that currently isolate global hospital networks. Scaling this framework establishes a globally verifiable, standardized digital health passport. Instead of fragmented databases, clinical records operate as a synchronized grid of patient-owned information. Securing this data layer is a mandatory prerequisite for modern analytics. By proving that medical data is untampered and structurally sound, developers can confidently deploy privacy-preserving AI models. MediVault functions as the foundational infrastructure required to safely execute federated machine learning, building a secure basis for the next iteration of global healthcare.